Hello again. If you have lived in the valley for any length of time, you've probably heard about something called valley fever. It's a disease that comes from the soil, and when it is stirred up or disturbed, a tiny spore can enter the lungs just by breathing in the dust. Let's take a look at how one valley man contracted this disease and meet a community medical center's physician who is researching and treating it.
When Fidel Cortez helped his mom with yard work, he never dreamed something in the dust and dirt would make him sick.
That's the only time I could really pinpoint that it wasn't too long after that that I came down with symptoms.
After working in the dust that day, Fidel, a nurse at Community Medical Center's Ambulatory Infusion Center, soon became sick.
I developed flu-like symptoms, fever, chills, just not feeling very well, tired, and I thought I was, again, coming down with a cold or a flu. Have you had an IV before? I couldn't shake it off, and the symptoms were progressively getting worse.
After several examinations and tests over a few weeks, Fidel's doctor pinpointed his problem.
He did an additional workup at that time and a blood test which came back with positive for the valley fever.
UCSF Fresno physician Robert Lipke is one of the region's leading infectious disease specialists. He says the valley fever fungus lives in soil and is spread through the air.
The germ is actually a fungus, and it predominantly grows in the soil here in the valley. That's why we call it valley fever, because that's the way it was first described. There's 150,000 cases annually in the United States. Most people who get valley fever don't even know that they've had the germ in their body, and that includes about 2/3 of the people who have an infection. They don't get sick enough to even warrant going to the doctor.
Dr. Lipke says only 1/3 of the people get sick, and still, it usually resolves on its own. But others need more help.
There's a small number of people who have more severe disease, though, with a progressive pneumonia or spread of the infection outside the lungs. That occurs only in a very small portion of people who actually get valley fever.
Dr. Lipke says pregnant women, people with weakened immune systems, and those of Asian, Hispanic, and African descent may develop a more serious and sometimes fatal form of the infection.
They don't have a higher incidence of infection, but when they do get infection, they're more likely to have progressive illness.
Fidel explains why his doctor is monitoring him very closely.
Because of the incidence of African Americans, Hispanic, and Asian population having increased incidence for complications from valley fever.
This disease is found in the southwestern United States, Mexico, and parts of Central and South America, and there are hot spots in certain areas, like our valley.
Particularly in the southern San Joaquin Valley. The area is interesting because the farther south you go, the more likely one is to acquire disease from the soil and from the dust. So Bakersfield has a higher incidence than Fresno. Fresno has a higher incidence than Modesto, and so forth. So the farther north you go, the less likely you are to acquire this disease. You can see that it occurs in California. There's also a gradation from east to west. In the foothills and on the east side, there doesn't seem to be as much likelihood of getting disease as there is in the western hills, particularly around Coalinga, Avenal, etc.
Valley fever is not contagious, but its effects can be debilitating.
The few that do get it, it can be very serious. I mean, even fatal. So, yeah, I was very lucky.
Fidel is still on medication, but his doctor says he's improving, and Fidel expects good results for the future.
I'll be off of the medication and just follow up, as indicated with him. So I should be okay after that.
Back at work and on the road to recovery, Fidel has a good suggestion when you're out in the dust or dirt.
It couldn't hurt to wear a mask,
Not a bad idea, Fidel. Good tip for us all when we are going to be putting ourselves in those dusty situations.